And we're back. I'm Emily Galindo, and this is Biz Talk on Now Media Television. Let's dive back into the conversations that move business forward. Loving what you're watching? Don't miss a moment of Biz Talk or any of your favorite Now Media TV shows, live or on demand, anytime, anywhere. Download the free Now Media TV app on Roku or iOS and enjoy instant access to our full lineup of bilingual programming in both English and Spanish. Prefer to listen on the go? Catch the podcast version of the show right on Now Media TV website at www.nowmedia.tv. From business and breaking news to lifestyle, culture, and everything in between, Now Media TV is streaming 24/7, ready whenever you are. Welcome back to Biz Talk. If you're just now joining us, I'm your host, Emily Galindo, and we are here joined with Scott Goodell with Goodell Health Solutions. We have been navigating the complicated life of Medicare and why it's so important, even for business owners, to really understand this what shouldn't be complicated, but unfortunately is. And Scott's here to shed some light on all of that. We just wrapped up understanding kind of Medicare 101, and now we're going to talk about how we can have fun with Medicare.
Yeah, that's
Look
the
at
best
this
part.
guy.
Yeah, right.
Outfit change and everything. So your shirt says Senior Dance Party.
Senior Dance Party. That's
What's
exactly
that about?
what it
Tell
is.
us about that.
So what I like to do is I like to go to 55 plus communities, and a lot of people when they go into these communities are looking to sell people on Medicare, obviously, because there's a lot of Medicare reps that are available or agents in the area. So what I do is I offer something a little bit different. I offer to do a senior dance party. I've been a Zumba instructor and a UJAM instructor, and I've done a lot of fitness classes. What I find is that my energy is contagious, and I can help people to be able to find their fitness goals. And just doing regular songs that you would know from the 50s and 60s. And we do like little routines and have fun with it.
Right, and you're bringing joy.
Yeah, joy is the number one thing. And so we do a song called YMCA. Most people know it, right?
Sure.
So it's YMCA. I had a friend of mine, his name was Vincent Vecchione, and he created a YMCA for me on my website. So it's now Your Medicare Agent. You can do it together. Your Medicare Agent. It's YMCA as well. And so now I have used that as my marketing piece to be able to go into 55 plus communities and help them with their fitness goals, as well as they get to know me, and if they want me to help them with their Medicare options, I can help them with their Medicare options.
And do you feel like that's a mutually beneficial, like they get joy, exercise, fitness, do you get business from it?
I get business from it. The good thing is that I'm always a resource for them. So if they have any questions throughout the entire year, they don't have to worry about waiting until open enrollment, which is going to be coming up soon. October the 15th through December the 7th is the open enrollment period. So they get to ask me questions. They, in most cases, a lot of them have questions that they need to know about, like their hearing or glasses, or if they go to a dentist. Sometimes there's a card that they get that offers them some type of benefit as far as over-the-counter benefits. And so instead of not using the card at all, if they come up to me afterwards and say, hey, I'd like to know more about this card and how do I use it, I like to go through the process of showing them exactly how to do it so they can get all the benefits in which they're entitled to.
I love that. And so I think it's really important for people to understand, as I've talked to you all day today, that there is way more to this than just, this experience in buying and using Medicare and having an agent and all of that should be, and in your world, you do believe it should be, way more than just October 15th through December 7th.
Yeah, it's a yearly thing. What I do is I treat everybody like my mom because I got into it that way. So if I was going to call my mom on her birthday and wish her a happy birthday, I'm going to do it for my clients as well. If I want to call my mom randomly and say, hey, how are you doing? I haven't talked to you in a couple of days. Tell me what's going on with you. I'd like to do that as well. It's more than just writing the policy. It's more about having a connection with somebody that knows, likes, and trusts me, that they can ask me anytime about something and I can give them the answer. I call them back within a 24-hour period of time. And I really feel like the sincerity of what I do is more than just writing the policy. It's about actually creating a relationship with somebody where they know that they can call without having to worry about calling a 1-800 number or being bombarded with phone calls, because we all are.
Right.
I mean, I just turned 51, and I feel like when I got onto AARP, I've been bombarded with tons of calls about Medicare, and I don't even qualify for it. So
they want to get you in that 55 plus community.
They do. I mean, that's fun. I hope to be in a 55 plus
I'm
community.
just saying, like
fun,
it's like
right?
an all-inclusive resort every day.
If I can stay there and work there at the same time, why not, right? Rent,
It's not a bad
rent's
plan.
better, right? I guess. I don't know.
It includes food, everything.
Sure. I mean, I'm willing to do that. I just don't know if I'm going to do it as soon as that. But yeah, 55 plus. I mean, I'm 4 years away.
I don't feel like that's a bad marketing plan we just came up with on the air.
If you're a 55 plus community and you would love to have me at your 55 plus community to just live and to be able to offer goodness to your clientele, call me. My website is
Yeah, no, please. Yeah, go ahead.
GoodellHealthSolutions.com. All you got to do is put on some information in there, and I will give you a call. I usually, again, do it within a 24-hour period of time. We're about to get flooded with a lot of different requests because, well, Medicare open enrollment starts on the 15th of October and it goes until December the 7th. So if you or your family members are looking for an opportunity to be able to sit down and talk to somebody that is knowledgeable and is going to steer you in the direction which is best for your pocketbook, then I'm the guy for you. I'll be your Medicare agent anytime that you would like, and I will offer solutions to you instead of just selling you a plan that I have.
Yeah, and you were on the podcast earlier, which I thought was really incredible about, like, your goal is to help people get the most out of their insurance policy with paying the least amount of money.
All day.
And I don't know if a lot of people say that out loud, right? Like, that's kind of the whole idea versus like, I want to sell you the most expensive policy so I get paid the most amount of money and have a nice day.
Yeah, it's never about the well, I say it's never about the profit. It's always about doing the right thing. And I feel like if I talk to you and you love the plan that you're on and it gives you everything that you want, I'm not going to sit there and try to sell you to try to get one so that way you can come and be my client. And that's what I talk about, doing the right thing. A lot of agents will go in there and within 15 minutes they already have you set up on a different plan because it's better for their pocketbook. I just want to be honest because, again, I'm going to treat you just like you're my family, and I don't want to have to worry about the repercussions of me putting you on something that just fits my budget than you. And in most cases, I'm going to tell you and not in most cases, in all cases, I charge you absolutely nothing to do a review with you. It costs you $0. If you want to do it on Zoom, I can do it on Zoom. If you would like to do it at a restaurant of choice, like some type of restaurant or a coffee shop, I can do that. Or if you would like for me to come to your house, I do in-home consultations. Mm-hmm. And if you have friends that, let's say that you live in a house and you wanted to have like 4 or 5 of your friends that are you're friends with that you may play bunco or canasta, or I think the biggest one now is like Mahjong.
Yeah.
If that's who you are and you wanted to invite other people, I could do like a 20-minute presentation for everybody to understand what the alphabet soup is. And then each one of you could individually allow me to be able to sit down and talk to you and find out what you currently have, what you're missing, and what you can get.
Right, yeah. I think that's what it's about, like, is because it's so, again, it's a complicated system which doesn't need to be complicated, but we can't fix it, so it is what it is, but we need somebody to help us understand that and give us options. Because even as a business owner and as a full-fledged adult and all of the things, I get an insurance policy from my corporate America, like, employment, right? And I don't even know what half of it means, and it just gets very complicated.
Right.
And I prefer to have somebody sit down and go, what do you need? What do you want? Here's up, like, all of that. It just makes it feel better.
We tailor it to your needs.
Yeah.
Everybody's got different needs. Not everybody is diabetic. Not everybody has a heart issue. Not everybody has different situations. And so it's pretty common that a husband and a wife would be on 2 different plans, where she may need something in her Medicare plan that allows her to have like compounds for like hormonal therapy and things like that. Her plan may be different than his because he may not need that. He may have diabetes and she may not, and so there's a chronic condition there that needs to be addressed, so we can figure out what that looks like. So a lot of people, I think, feel like one plan fits all, and in most cases it doesn't.
Right, absolutely. Mm-hmm. And so the segue of you getting to have those conversations is some of these senior dance parties.
Yeah, so the senior dance parties are fun. If y'all have ever been and done a chicken dance, we do the chicken dance. We do nothing can take me away from my guy. And so we have fun. Again, if you know somebody that is a event coordinator at one of the 55 plus communities here in the Houston and surrounding areas, I would love an introduction to be able to speak to them.
I think I know somebody.
So we could line it up. And again, I don't come in with the intent to push everybody to come to me for Medicare. It just naturally happens because I'm doing goodness and having fun with people. And I feel like when you start having fun with other folks, they gravitate to you in a connection that's different than me trying to pound the phone and trying to have the best 8 seconds to keep you on the phone for you to be able to realize, oh, I'm actually a good guy.
Yeah. Yeah. No, I think that and the way you're doing it is exactly the best. That's how we would hopefully all business owners could and would, I think, be more benefited by if they would just do the right thing and do it from a good place to really want to help people, and the money will all come on the back end.
Find your niche.
Yeah.
That's what I'm saying. There are thousands and thousands of Medicare agents everywhere. There are people that work for the company's names, or they can only offer you the plans that company has, or that carrier. And then there's people like me. There's thousands of them, and everybody since Texas is so big and populated with seniors, other than Florida, everybody in the country gets to try to be a piece of the Texas pie right here. We have people turning 65, 400 and turning 65 every day in my backyard. And so when people are like, are you licensed in other states? I'm like, I don't need to be.
Right.
My business is right here.
And you are a homegrown Tomball Texan.
I'm homegrown right here. I'm born in the Heights Hospital, so I'm a native Houstonian. So I speak Houstonian, but I also speak Medicare, which is awesome because if something were to happen and you need to have a claim or you get a claim denied, I am your go-to guy at no cost to you to be able to call that carrier and see if we can get that resolved for you. A lot of times people are skeptical about what happens in Medicare because of the denial of claims that happen. If that's you, I can help you out with that. I speak Medicare to all the carriers, and we need to do something for you. You should never be denied any type of coverage when you are deserving of it and you qualify for it.
I love that. And so if you've got one of those denials, reach out to Scott. One more time, how can everybody find you?
My website is goodellhealthsolutions.com, goodellhealthsolutions.com. The information is probably here. The beautiful woman that you see in that photo captured with me is my mom. So she is my biggest fan because she's the person that got me into this. So, but we provide solutions across Texas, and we put the care in Medicare because it's more than just writing the plan.
Thank you so much, Scott. I love that you can make it sound so simple and help us understand and make it really fun. And so thank you for taking care of all of our moms out there in Texas.
And for my Spanish speakers, Levanta el techo, Levanta el techo.
Thank you guys. We'll be right back after this commercial break. We are just getting started. Stick around and we'll be right back with more lessons, insights, and behind-the-scenes stories from the people driving real business forward. You're watching Biz Talk, only on Now Media Television.